In this video, I'm going to show you how to screen for raised blood sugar and diabetes using a point-of-care device like this one. First, I'm going to show you how to prepare the patient. Then I'm going to show you how to measure blood sugar using a point-of-care blood glucose meter. And finally, I will show you how to interpret the measurement. To prepare the patients, if possible, ask them to wash their hands beforehand, then ask them to please sit down on a chair for the procedure. Until the last couple of years, all blood glucose meters read the glucose level in your blood sample as whole blood. Several years ago, manufacturers developed a meter calibrated to read the blood glucose sample as if it were plasma. The results of which are more comparable to laboratory glucose tests, as blood samples are spun to extract plasma before analysis. Most meters now provide blood glucose readings as plasma glucose readings. It's important for you to know what your meter reads and what your glucose targets are for the meter you are using. Plasma equivalent values for glucose are about 10 to 12% higher than the whole blood or capillary numbers. For fasting venous plasma glucose of 6.1 millimoles per liter, the equivalent value is 5.6 millimoles per liter. For performing the test, you'll need a meter, test strips, a finger pricker or lancing device, a lancet, and cotton wool. Remove the cap of the lancing device. Load a new lancet into the finger pricker like this. And put on again the cap of the lancing device. Then put the test strip into the blood glucose meter by introducing the test strip from this side. Some devices might switch on automatically when you introduce the test strip. Down here, it shows that the results will appear in millimoles per liter, but you can show the results in milligrams per deciliters. The screen of your blood glucose testing device might also show other additional information like time and date. You can prick the patient's finger on the side as it is less painful than at the tip or pad. Once there is a little drop of blood on the patient's finger, take the meter with the test strip and carefully put the blood drop on the strip. The result should appear on the screen of the meter device within a few seconds. Clean the patient's blood on their finger with a piece of cotton wool and give them a piece of cotton wool if there is a bit more blood. Make sure you dispose of the lancet in the sharps container. The results of the blood glucose test depend on the time you have taken the measurement. If sugar is measured first thing in the morning before the patient has eaten, or at least 8 hours since their last meal, the results you obtain with the test are the patient's fasting plasma glucose levels, or FPG, also known as fasting blood sugar. If the patient has eaten 2 hours before the test, then what you measure is the 2-hour postprandial plasma glucose, or PPG. Any test done between 2 hours and less than 8 hours is the random blood sugar, or RBS. The results you obtain can indicate whether a patient has diabetes, has impaired fasting hyperglycemia, or IFG, or has impaired glucose tolerance, or IGT. Impaired fasting hyperglycemia, or IFG, is a state of higher than normal fasting blood glucose level, but lower than the diagnostic cutoff for diabetes. Impaired glucose tolerance, or IGT, is a state of higher than normal blood glucose concentration 2 hours after 75 grams oral glucose load, but less than the diagnostic cutoff for diabetes. A person who has diabetes is defined as someone with fasting plasma glucose value above greater or equal to 7 millimoles per liter, or 126 milligrams per deciliter, or a 2-hour plasma glucose level is greater or equal to 11.1 millimoles per liter, or 200 milligrams per deciliter, on 2 separate occasions. If the patient is symptomatic, a diagnosis of diabetes may be made with one positive result.